So hello guys, welcome back with me with a new video of orthopedics. So chapter 35, degenerative disorders. So in this we are going to cover about OA, mainly osteoarthritis. So let's talk about it. So here is a definition. So let's start. Osteoarthritis is a degenerative joint disease. Etiology means mainly the cause. It's multifactorial and still not understood. Commonly, it is thought to be wear and tear of a joint as one ages. There are mainly two types organized. It's primary and secondary. So, जो OA होता है वो मेनली डीजेनरेटिव जॉइंट डिजीज़ होता है. इटियोलॉजी मीन्स कॉजेज़, तो इसका मल्टीफैक्टोरियल होता है एंड स्टिल नॉट अंडरस्टूड. अभी तक इसके कॉज इतना पता नहीं चला है. कॉमनली ये वेयर एंड टीयर होता है जॉइंट्स का जब एक इंसान की एज हो जाती है. तो अब हम बात करेंगे फर्स्ट टाइप प्राइमरी OA. सो लेट्स स्टार्ट. आई विल जस्ट मार्क इट विद अ मार्कर. या सो प्राइमरी OA. This occurs in a joint de novo. It occurs in a old age, mainly in a weight-bearing joints, knee and hip. These are the main joints because they are weight-bearing. In a generalized variety, the trapeziometacarpal joint of a thumb and distal IP joint, interphalangeal joint, fingers are also affected. Primary OA is commoner than the secondary. So, प्राइमरी OA मेनली 4 जॉइंट्स में होता है. तो फर्स्ट इज़ नी, सेकेंड इज़ हिप, थर्ड वन इज़ ट्रेपेजियोमेटोकार्पल जॉइंट TMC, and the fourth one and the last is distal IP, interphalangeal joint. So knee, hip, trapeziometacarpal joint of a thumb, and DIP, distal interphalangeal joint of a finger. So let's talk about the secondary OA now. So secondary OA, in this type there is an underlying primary disease of a joint which leads to the degeneration of a joint often many years later. It may occur at a age after the adolescence and occur commonly at the hip. Causes of a secondary OA. So first one is avascular necrosis. Then talking about first is idiopathic, means not known yet. Then second is post-traumatic, like a fracture of a femoral neck. Third one is alcoholism. Fourth one is a postmortem osteonecrosis. Fifth is chronic liver failure. Sixth, patient on steroids. Seventh, patient on a dialysis. And the seventh is sickle cell anemia. So, this is coxa vara, CDH, congenital dislocation of a hip, old septic arthritis of a hip, malunited fractures, and a fractures of a acetabulum. So, let's move further in this. So, predisposing factors. Let's know about the predisposing factors here. So, the first one here is the congenital malformation, development of a joint, irregularity of a joint surface's previous trauma. So, the third one is the previous disease producing a damaged articular surfaces. Fourth one is the internal rearrangement of a knee, such as a loose body. Fifth one is a malalignment, like a bow legs. Talking about sixth, there is obesity and an excessive weight. So, moving further towards the pathology. So, let's talk about the pathology here. Okay. So, osteoarthritis is a degenerative condition primarily affecting the articular cartilage. The first change observed is an increase in a water content and a depletion of a protoglycans from the cartilage matrix. So, repeated weight bearing on a such cartilages leads to its fibrillation. Fibrillation means mainly the degeneration of a bone or a joint. The cartilage gets abrated by the grinding mechanism at a work at points of a contact between the opposing articular surfaces until eventually the underlying bone is exposed. With the further rubbing, the subchondral bone becomes hard and glossy. Meanwhile, the bone at the margin of a joint hypertrophies to the form a rim of a projecting sperm. Meanwhile, the bone at the margin of a joint hypertrophies to form a rim of a projecting spur known as a osteophytes. A similar mechanism results in a formation of a subchondral cyst and sclerosis. So, loose flex of a cartilage inside the synovial, inflammation, and a thickening of a capsule leading to the deformity and a stiffness of a joint. Often one compartment of a joint is affected more than other. Like example, knee joint, the medial compartment is affected more than the lateral and leading to the varus deformity known also as the genu varum. So let me explain it to you. So, mainly the osteoarthritis, as I told in the definition, it is a degenerative condition primarily affecting the articular cartilage. So, let me show you the image of an articular cartilage of a knee. So, as we can see here, so let's see the easy way to understand it in a flowchart pattern. So, let's see. So here is a flowchart in which you will know the pathology in the easiest way. So let's start with it. So there is an increase in a H2O, means mainly the water, and depletion in a protoglycan due to the repeated weight bearing, fibrillation, grinding mechanism between the articular surfaces. So there will be the rubbing of a subchondral bone. So what is a subchondral bone? So as we can see in this image here, so this is subchondral bone here. See the diagram, it is the healthy side and one side is the osteoarthritis side. So one side it is healthy and other side, as we can see, it is been degenerated. See here, there's a osteophyte formation here, subchondral bone remodeling. So let's move here. Rubbing of a subchondral bone, it makes the bone hard and glossy. So due to this, there is a margin hypertrophy to form the osteophyte, as I've shown in the previous picture here. So mechanism result in a form of a subchondral cyst and sclerosis due to the loose flex of a cartilage. There's inflammation in a synovial joint or a synovial membrane, due to which the deformity has been resulted like osteoarthritis, and there's a stiffness in a joint. So let's moving further towards the PDF. Yeah. Okay. So I have explained the pathology in a simplest form in a flowchart. Now moving towards the clinical feature here. So the disease occur in an elderly person, mostly in major joints of a lower limb, frequently the bilaterally. There is a geographical variation in a joint involved, depending probably upon the daily activities of a population. So the hip joint is commonly affected in a population with the Western living habits, while the knee is involved more commonly in a population with the Asian living habits. So the habits like squatting and sitting cross-legged. Moving forward, knowing the symptoms of OA. So the first earlier symptom is pain. Okay. Moving further, pain is the earlier symptom. It occurs intermittently in the beginning but becomes constant over the months or the year. Initially, it is a dull pain and come over on starting an activity after the period of a rest. But later it becomes worse and cramp like. Okay. अगर पेन वर्स हो जाता है डे टू डे टाइम में या मंथ एंड ईयर्स में, तो ये वर्स हो जाता है एंड क्रैम्प लाइक हो जाता है. ओके, आफ्टर द एक्टिविटी. A coarse cryptis may be complained by some patient. Cryptis mainly means a sensation or a tingling like sensation or a vibration felt in a joint during the activities. Swelling is the third. Swelling of a joint is usually a late feature and it is due to the infusion caused by the inflammation of a synovial tissue. So, then the fifth one is a stiffness. It is initially due to the pain and a muscle spasm, but later capsular contracture and an irregularity of a joint surface contribute to it. Other symptoms are the feeling of an instability of a joint and a locking resulting from the loose bodies and frayed meniscus. Okay. So moving further towards the examination, how we will examine the patient is having the OA or not. So following findings may be present. So let me choose the marker. The following findings may be present. First one is a tenderness on the joint line, cryptus on a moving joint, irregular and enlargement looking joint due to the formation of a peripheral osteophytes, deformity, varus of a knee, flexion, adduction, external rotation of a hip. Further, infusion, rare and transient, terminal limitations of a joint movement, subluxation detected on a ligament testing, and a wasting of a quadriceps femoris muscle. Okay. So, here is the investigation. So, how we will investigate it through the radiological examination. So, here it is. So, investigation, mainly the radiological examinations. So, let's study about it. So, radiological examination. So, I'm reading up the paragraph. The diagnosis of osteoarthritis is mainly the radiological, like in a figure 35.1, we will see the following are the sum of the radiological features. So, narrowing of the joint space, often limited to the part of a joint, may be limited to the medial compartment of a tibiofemoral joint of a knee. Second, the subchondral sclerosis, dense bones under the articular surface, subchondral cyst, osteophyte formation, loose bodies, and a deformity of a joint. So let's see in a figure 35.1. So we can see here it is an X-ray of a knee, anterior, posterior, and the lateral view. The first X-ray is the anterior and the posterior, and the second one here is the lateral view. So as we can see here in a circle, the joint space has been reduced here, and here we can see. So further there is a other investigation here. So are made primarily to detect the underlying causes. Consist of the following: serological test and ESR to rule the rheumatoid arthritis, mainly RA, serum uric acid to rule out the gout, arthroscopy if the loose bodies or the frayed meniscus has been suspected. So moving towards the treatment of it. So treatment. So first we will see about the principle of a treatment here. So once the disease starts, it decreases. So principle of a treatment: once the disease starts, it proceeds gradually and there is no way to stop it. Hence, efforts are directed wherever possible to the following. So the first, to delay the occurrence of a disease if the disease has not been yet. Second, to stall the process of a disease and relieve the symptoms if the disease is in the early stages. Third one, to rehabilitate the patient with or without the surgery if his disabilities can be partially or completely alleviated. So, what are the methods of a treatment to treat the osteoarthritis patient? Achieve the above objectives, the following therapeutic measures may be undertaken. So, the first treatment has been the drugs. So the first treatment has been taken are the drugs. Mainly analgesic are used to suppress the pain. It is a long acting formulation are being preferred. Moving towards the second, there is a chondroprotective agent. Agents such as a glycoside and chondroitin sulfate has been introduced in calming to the agent which has been result to repair of a damaged cartilage. Moving towards the third one, there is a viscosupplementation. So let's see. So the sodium hyaluron has been introduced. It has been injected in a joint 3 to 5 times at weekly interval. It is been supposed to improve the cartilage function. So moving towards the fourth point is supportive therapy. So this is useful and harmless method of a treatment and often gives gratifying results. So the first one is a weight reduction, avoidance of a stress, local heat, exercises, and the counter irritants means the local application of a counter irritants. Now moving towards the fifth point of a treatment is the surgical treatment here. In a selected cases, surgeries can provide the significant relief following are the some surgical procedures performed for OA. So, first we will know the names of the surgical procedure. Yes, the first one is a osteotomy. Second here is a joint replacement. So second here is a joint replacement. So third one is a joint debridement, and fourth one is a arthroscopic procedure. So let's see them. Starting with the osteotomy. Osteotomy near a joint has been known to bring about the relief in a symptoms. Moving further, intertrochanteric osteotomy for the OA of a hip have been shown to be useful for the pain relief. So in figure 35.2 here down, we can see the first image or a X-ray here. It's high tibial osteotomy, the first image, and the second image of a X-ray shows the total knee replacement. Moving towards the second replacement. So second is a joint replacement. In cases crippled with an advanced damage to the joint, total joint replacement operation has been provided the remarkable rehabilitation. The artificial joint serves for about 10 to 15 years. So moving towards the third, there is a joint debridement. This operation is not so popular now. In this, the affected joint is opened, degenerated cartilage smoothens and osteophytes and the hypertrophied synovium excites. The results are unpredictable. Moving towards the last procedure, there is an arthroscopic procedure here. Arthroscopic removal of a loose bodies, degenerated meniscal tears, and other such procedures have become popular because of the less invasive nature. In arthroscopic chondroplasty, the degenerated fibrillated cartilages is excised using a power driven shaver under the arthroscopic vision. Result are unpredictable. So hope you like my video guys. Please like, share and subscribe for the more wonderful videos. If you need any notes of the subject, please comment down. Thank you.